morning, everyone. It's a delight to be the person to open this conference on Monday morning. Thank you very much for hearing me out. I'd like to start with the past. The past, when I started in this area in 1978, I was a graduate student, and I'll be the first to admit, I chose working with child abuse because there was such a sparse literature that it took me about a day to review the whole thing for my dissertation. So I thought, this is great. So I moved over from alcohol studies to child abuse and neglect. What a connection that was. So at the time, there was only one treatment study out there. So I started to work with treatment in child abuse and neglect. And I'll tell you, people ask me, how did I get into prevention? Why do I work with adolescents? Well, it's because of this early work I did in Florida. When I remember one case where I was going out and trying to collect data from these parents and observe them in their home with their kids. I went to the trailer parks. I think the social workers at the agencies there said, oh, let's send that guy, David Wolfe, over here to this family, see what he does, with this new idea he had. I was just trying to teach him parenting. So I went out to one of the homes one day, and I'm observing his child, explained to the father why I was there. And as I was doing that, he was sitting there cleaning out his pistol in front of me. So, in the words of our speaker last night, my amygdala was speaking directly to his and vice versa. When I went back a week later, that trailer home had been burnt to the ground. There was an explosion in it. And that was my introduction, if you will, to child abuse. I thought, this is not going to be so easy that I thought it was. But at the time, and in the past, most of us here learned that we were really interested in defining the issue, finding out what it was about. We vilified it in the sense that we created monsters out of child abusers and that. My belief, though, was that a lot of them were struggling parents, people like you and I and our parents that were trying to figure out how to raise kids. Some of them were extremely violent and abusive, but the majority of them to this day are lost and confused, don't have guidance, and have other issues going on in their life, numerous ones. So we knew that we couldn't just go out and teach them one thing, and we couldn't just take their kids away or promote some particular message for them. What we really needed was a broader strategy. What we really needed is an effort to prevent child abuse, because as I learned right from that get-go, child abuse is easier to prevent than it is to treat. We always are going to need treatment, but we don't do nearly enough for prevention, and it is much easier to prevent child abuse and neglect, much less expensive, much more rewarding, because you don't have to wait for them to come to you in a disaster or crisis. We're there to offer them what they need. There's many ways to do it, and that's what we're going to cover in this brief talk today. In order to talk about child abuse prevention, we first need to do a quick overview of what our principles are around prevention. If your primary concern is reducing serious harm to the child, then your approach is most likely to involve detection and policing. And this is how it started out 30, 40 years ago. But if your primary concern is cost and efficiency, then we're going to look for crisis management. And we have to ask ourselves, how much crisis management do we need, and is that enough? If it's child protection, we look for alternative care arrangements, so we get the child out of the way of harm. If it's protection of society, we talk about increased jail sentences and tougher laws. These have all been touted by many politicians over the years because it sounds good, but it doesn't really do much good. If our primary concern is deviant behavior and mental illness, then we need to have improved mental health screening and psychiatric services. So at one time or another, in one place or another, all of these issues have been the focus of our primary concern. And we shift from one to another. And we try to deal with a problem, but it's never quite enough, is it? My view is that if our primary concern is family support and assistance, if it's strengthening the child and family development, recognizing all forms of violence as public health issues, then we have to look at access to services, proper timing of our assistance, interagency cooperation, and community coordination of services. And that's why what you're going to hear me talk about in the second half today is how we teach healthy nonviolent relationships to everybody. I'll get to that in a minute. The conclusions from our principles basically can be summarized, I think, in two simple concepts. To prevent child abuse and neglect, you decrease risk factors, of which there are many, poverty, jobs, education, and such, or you increase resilience. Those are the fundamental principles. We lose track of that sometimes, but basically anything you do to increase resilience or reduce risk factors is a form of child abuse prevention. Now, Harriet Macmillan published this chart a couple of years ago on prevention opportunities. So I just want to point out all the different spots along the continuum where we can be doing some form of prevention. Universal and targeted prevention is designed to prevent child abuse and neglect before it even occurs. These are the programs that are more lacking. There's not enough of them. They're expensive to start, expensive to evaluate, but probably the most important when we stop and think about it, that we need more of. Once some form of abuse has occurred, sexual abuse, physical abuse, domestic violence, and so forth, there's other forms of prevention. We're trying to prevent the recurrence of abuse, or we're trying to prevent the impairment from abuse. So most of us here work at some point in that continuum, and I want to challenge you to work at all points of it as much as possible, to shift a bit and say, not only do I have to work perhaps in deep end to deal with the crises every day, but I also want to work a bit in the upper end and try to prevent some of these things from happening. And more of us, I encourage you to speak out and find ways to do that. Don't allow your supervisor to make you do the deep end all the time. Convince supervisors and others that it's also important to be teaching people what you know and preventing them from that deep end issue. This brings us to the present. I'm going to go over this quickly because these are issues that you may have read about. This is stuff that's been going on for at least 1 or 2 decades and has more and more of a evidence-based information to support what's effective and what's not. But this review that was done just a couple of years, 3 years ago now, 4 years ago, by Mickton and Burchard, Child Abuse Maltreatment Prevention, they looked at the strategies that we've used over the last 2 decades to prevent child abuse and neglect, organized them into 7 strategies, and looked to see what is the evidence for these strategies. 26 reviews summarizing 298 evaluations, treatment evaluations. Based on this, one of those common programs or strategies, I should say, is early childhood home visitation. Provide support and education and information for families, improve child health and parenting ability. These are the focuses, and effective at reducing risk factors of maltreatment, showing effectiveness of that. And the nurse-family partnership is a well-known one there. We know that they've followed these kids up for many years and shown a lot of reductions in child abuse and harm. At the present, we also have parent training and education programs. These are usually out-of-home, group-based programs, seek to improve child-rearing knowledge and skills. And they've shown small to medium effect sizes on the basis of risk factors. And some of them are moving more into public health models where they try to reach a much larger group of families. And I think a good example of this is the Triple P program, many of you have heard about. What I like about Triple P is it offers different levels to families, so it's not one size fits all, and I think it's very clever. At level 1, everybody gets a dose through the media and information, school handouts, and so forth. Then there's a selected level where you have more brief consultations. I need a little bit of discussion around my kid, or I need a little bit of help, and then it goes deeper and deeper. Standard in groups. And level 5 being enhanced, augmented version, where they may be doing more ongoing, consistent therapy with the families. The other strategies, sexual abuse prevention is also out there, so it is an important part of it. Most of these prevention programs have been delivered in the school. This is based on reviews of over 15 trials, and what we know about what's effective for child abuse, sexual abuse prevention. The combination of films and videos, discussions and role plays, and so forth. The good touch, bad touch programming. We do know they're effective at strengthening some child protective factors, We don't know, however, if they're effective at really preventing child sexual abuse. And many of you, including myself, are concerned that this is the only form of child abuse prevention that's aimed at teaching the child what to do as opposed to teaching the perpetrator what not to do. It's a bit ironic, but that's the only way that we seem to have approached this in the literature. Also, most of these programs are very short-term follow-up. So there's some effectiveness. They are universal, but are they hitting the nail on the head? We're not sure. The other current programs, abusive head trauma and enhanced pediatric care programming and strategies, these have shown fairly good evidence where you teach parents from the beginning about shaken baby syndrome and so forth. The program called Safe Environment for Every Kid by Howard Dubowitz has shown a lot of effectiveness in this regard. So that strategy. Limited outcome evaluation. Then multi-component interventions, mostly aimed at neglect, mostly aimed at reducing some of the risk factors that we know about child abuse and neglect, providing support, preschool education, parenting skills and such, like Project 12 Ways and Project Safe Care. These have shown moderate effect sizes and valuable in some circumstances. As I say, I want to go through these quickly. I don't want to dwell on them, but we have media-based interventions, very few really good outcome evaluations, but we all know media is very important in terms of basic education for parents and the public. Media campaigns to educate people. And there's a recent child abuse review article by Chris Goddard and Bernadette Saunders. I'm going to quote from them because I think they hit the nail on the head in the importance of the media. The media have been essential to the task of placing the problem of child abuse in the minds of the public and on the political agenda. The media played a major role in defining what is normal and what is deviant in society, thus contributing to definitions of what is and what is not considered to be child abuse. And the last strategy, and the oldest strategy, is support and mutual aid, aiming to strengthen parents' social networks such as Parents Anonymous. And unfortunately, there's just little or no evidence of effectiveness of this, although it is still the most common strategy in most communities, probably because it's inexpensive, and the people that believe in it believe in it. There's just no evidence about it, unfortunately. So, to conclude, there are 4 good strategies here. 4 of these universal and selective programs are very promising for preventing maltreatment. Home visiting, parent education, abusive head trauma, and multi-component, But most of these studies, almost all of these studies, have been done in high-income countries. None of them have really focused much on the issue of neglect. What's missing here? Let's turn our attention for a minute. Which of these strategies am I going to go forward with in the future? What am I going to pull from this, do you think, and say this is where we want to go? How many of you here work in law enforcement? By show of hands. Zippo, it looks like, maybe one. How many of you work in healthcare? All right. How many of you work in child protection? And how many work in some form of social work or psychology and mental health with families? How many of you work in education, please? Wrong, you all work in education. Every single one of you, no matter what you do, that is what you're doing every day, is you're educating people. And I think it's time to look at our strategies a little bit differently. How do we really prevent child abuse? What is the method of preventing child abuse and neglect? It's education. We can't go in and change their brain. We can't medicate it away. We teach. Whether we're teaching people after they've been in trouble, so to speak, or whether we teach them before, it's education. It's educational strategies. We have just about no other armamentarium at our disposal. There's no easy way to try to rid the world of this other than through education. So who do we educate? How do we educate? What do we teach? When do we do it? Those are the questions I want to turn our attention to. As you're going to see me explain, we teach it to everybody we possibly can. But when you're talking about education, where does education occur? It occurs in schools. That's where all the kids are. So if we really want to address child abuse and neglect, 20 years ago I sat down and I said with Peter Jaffe, when I met Peter, when I first came to Canada, he was working in domestic violence, I was working in child abuse, and we discovered we're really working with the same families here. He's talking about men who beat their wives, I'm talking about parents, men and women who beat their children. We discovered that they're kind of inseparable. I bet there's none of you here that have ever worked with a family that didn't have either substance abuse issues, domestic violence issues, extreme poverty issues, and so forth. These things ride on the same bus, and it's time we start looking at them together instead of separately, and trying to address these things as if they're separate issues. My view is, in order to teach the prevention of child abuse and neglect and to educate people, we have to look for what it is, the core elements among all these issues of violence, not just child abuse. What do they have in common? And believe me, they have many, many things in common that will inform us in terms of how we're going to teach this. Let me just point out a few of them. When we look at the commonalities among forms of violence in the home, we're not talking about in the community, but in the home. When we look at forms of violence in the home, we tend to see the same types of common features. Let's first look at the distal ones. The distal ones are the things in the background of people that are known to exhibit forms of violence. Antisocial behavior in childhood and adolescence, common factor. They've been showing some of these problems for a long time. Child maltreatment, the best predictor of negative outcomes I can think of, whether they're mental health or abuse and neglect and so forth, is their former experiences of maltreatment. I've never seen such a strong predictor, except maybe socioeconomic status. Exposure to intimate partner violence, very common in their background. Peer influences and what I call gender role rigidity. Kids growing up thinking that if I'm a boy, I have to act this way, and if I'm a girl, I have to act that way. All these things play a distal role in preparing people for their relationships, close relationships, as they near adolescence and adulthood. Deviant peer associations being part of that, and shared beliefs and attitudes about females. These are the things that boys and girls are learning as they grow up. Poor relationship models, poor lessons about how to have healthy relationships. What about the more proximal factors, the things that, that can create an abusive situation at the moment? You bring together those distal factors that are common, and at the moment you're going to see feelings and emotions of jealousy and anger. Attributions of blame, justifying that it's okay to hit somebody because they hit you first, or because they did this, or because they did that. In order to be violent, you have to justify it. We know that from cognitive science, and it's so easy to justify it when you grow up with it, or you see it's effective, or you believe in it. So in the moment, you justify it, you attribute it, and you don't think there's many consequences for it. Everyone does it, it's okay, I see it everywhere. These are just the common elements. So what do we do in order to teach these things? How do we go about that? And this is, in my case, I chose adolescence. The reason I chose adolescence is partly because David Olds has already kind of wrapped up early parent-child stuff. He was really doing a great job back in the early 90s working with mothers and young children, because I thought that is a perfect window to work in child abuse prevention. Where's the other window? The other window is early adolescence. There's many others, but this is the other one that I chose. Why early adolescence? Mostly because my kids were not quite adolescents at that point, so I figured I still had hope. But adolescence is marked by autonomy and transition. Their job is to move away from the family, to be different, to be more like their older brothers and sisters or their peers, less like their parents, and that kind of thing, to find their own identity. That is their job. And their job is to experiment, to try out new things, to be different, to look different. That's all good. But there's also, at the same time, this pressure to conform in adolescence. You can be different, but as long as you're different that I understand. You can't be too different. Or I'll patrol the borders, as we like to call it. Gay baiting, homophobia, and peer violence is so common. We patrol the borders to watch to say, are you more different than you should be? You don't look like my image of what a guy should look like. Why the gay term is so common in high schools today is to try to shape them back to the way I think they should be because of my rigidity. The reason kids are so rigid at this age, just as an interesting developmental factoid, is when they were little, shaping the world into basic black and white is very important for kids at age 2 and 3 to understand how confusing it is. Moms do this, dads do that. Guys drive trucks, moms do laundry. Very sexist, very divided, very black and white, and that's simply because they have to make sense of a confusing world. That dissipates in elementary school, but comes back with a vengeance in middle school. Because now, as they move into a high school or middle school where there's a lot of new kids, a lot of new pressures on them, they try to figure this out, and the best way to do it is to go back to black and white thinking, I better be just like this and not like that, because that's what guys are going to look for and girls are going to look for. This is just sort of the background of what we're trying to deal with here. They also are very confused about how they signal intimacy with one another, especially with dating relationships. So I decided that this was a good time to go about to do this. And how do we do it, though? One day I had a Zen moment. I came home one day in the afternoon, there was my son sitting there, TV was on, he had a computer in front of him, he had a cell phone. He was typing in the computer, doing something on the cell phone, he had a notebook open in front of him. I said, what are you doing? And he said, I'm doing my homework. I said, okay. He turns to me and says, Dad, what's sexual harassment? And like any caring, loving dad, I said, what the hell did you do? He was 14 at the time. He said, I didn't do anything. I'm supposed to ask my parents what's sexual harassment. I said, Alex, come on. Why would you have to ask us unless you got into some kind of trouble? He said, my coach told me to do it, my teacher, my phys ed teacher. What are you talking about? Did you learn about it? Did you talk about it? Did you read about it? No, he said to go home and ask my parents about it. So I was relaying this story to a friend of mine who's a teacher. He said, oh yeah, they changed the curriculum in the high schools. You're supposed to teach about healthy relationships. You're supposed to teach about personal safety. Up until that point in Ontario and most states and provinces, and probably over here, personal safety meant seat belts and bike helmets, don't talk to strangers, and so forth. That was personal safety. When you got to grade 9 or 10 or 8 in high school, the most dangerous time in your life, personal safety was not taught anymore. You didn't think you needed it. You knew how to cross the street. So they introduced this in 2001 in Ontario, and I said, whoa, what an opportunity. Because the teachers didn't know what to teach. They had a curriculum, and they have requirements, guidelines in there, but they had no materials, they had no background, no training in it. So we developed one, and that's what I'm going to talk about now. Thank you to my son for my Zen moment. We developed a program called the 4th R. We named it 4th R after something in North America. I don't know if it's common over here: reading, writing, arithmetic, and relationships. The fundamental common element of domestic violence, dating violence, child abuse, elder abuse, woman abuse, is relationship issues. The most common issue is navigating these relationships, understanding and respecting those relationships. I left out sexual abuse. It is not a relationship issue. It's a different issue altogether. If these things are relationship issues, how do we address them without waiting until something happens? And how do we address child abuse versus woman abuse and so forth? I chose dating violence because that's what the kids were interested in, and it is pretty much on the same continuum as these other issues. We first were interested in trying to teach adolescents about child abuse. They didn't want to learn about child abuse. They didn't have kids and weren't interested in that, but they did want to date. They're very interested in that, and they didn't know anything about it. And they were going by models that would turn your stomach if you look at some of the stuff in terms of what's expected in a dating relationship with Rihanna and so forth, Chris Brown. That was their model. I had no idea. So the fourth R was developed to be a relationship-based approach to teach what we want you to do, what you should do, and how to do it, as opposed to just teaching them what not to do. We combined peer and dating violence, substance use and abuse, and healthy sexuality, because lo and behold, that was what was required in the curriculum. In order for programs to work in the school, a very simple concept: teach what the teachers, or give the teachers what they're supposed to teach. Just help them do it better. They won't teach it if it's not part of the curriculum, because they don't have the time. And all of us here, at one time or another, thought to ourselves, I imagine, wouldn't it be nice if I could go and teach some of this in the classroom? So maybe you've tried to do that and you find it frustrating, or you've done it once or twice, but to keep coming back is very difficult. We wanted it to be delivered by teachers because they're the ones that teach. We wanted it to be delivered in the classroom because we want everyone to get the message, not just kids who are taken out of the classroom or have special needs or got into trouble. A universal approach means a dose for everybody. It's not a cure for everybody, but it brings the public health level up a big notch. We're educating the population. 100 years ago or more, the same argument was given about mathematics. You don't need everyone to learn mathematics, just give them the basics. You can learn that in one class. Today you get math all the way through high school. I believe, and I hope I'm right, that we're at the beginning of a change, a shift in how we educate kids, because every teacher in the classroom, most parents will say, you know, my kid really, they do okay at school, but they don't know anything about relationships. And this came out in the Columbine massacre years ago when they interviewed some of the kids. They said, we had the best sports teams, we had some of the best clubs, we had the smartest kids, we all went to university, but we didn't know anything about relationships, and we bullied each other, and we were mean to each other. And they ended up contributing to this atmosphere. So the fourth R is comprehensive in that we're not trying to just teach around a certain thing of dating violence, we're trying to teach around the adolescent. Adolescents need the whole picture. They need to know how to navigate sexual issues, substance abuse issues, dating issues. And all of this, believe it or not, contributes, I believe, to healthy relationships that will guide them when they have their own families. So what is it? The program was developed to help them strengthen their relationship skills to make safe and responsible choices. That's a fundamental aspect of what it was. Remember, the curriculum said teachers are supposed to be teaching these things, but they didn't have any school tools at their advantage to do this. So they were bringing in speakers or public health nurse, putting condoms on bananas and things like that. That's okay, but you needed a little more than that, because the kids would say they didn't really understand the things leading up to that banana aspect. We kind of skimmed over the important stuff and the relationship stuff. Address the common elements of these risk factors, or what we call the goals of adolescence. What are they trying to achieve here? Speak to them about it, make it interesting, because it's very relevant. If you can't teach a course or a class that includes sex, drugs, and violence, basically, there's something wrong with you. These kids should be dying to get into your course, into your class. It should be much more interesting than math and English. It should be very relevant to them. All kids have to take health class, I'm sure here as well as in North America. And that's why we chose health class. It also happens to be where the curriculum is, but it's a health-related issue. We try to counteract pro-abuse messages, which are everywhere in the media from their culture. Gender, race, sexual orientation, these types of things that all contribute to abuse, all contribute to the black and white thinking of, I can do this because I'm this way and they're that way. They look gay, I don't look gay, so I can tease them about that. because it elevates my status, and on and on. We have to teach around these issues. These are fundamental to what healthy relationships are, because that's what leads to justification of violence that I mentioned. If you don't understand that that isn't right, isn't the discrimination that you're using is wrong, then you won't, if you don't understand that, you will end up justifying that it's okay to treat someone differently than you. Emphasize positive message of safety and harm reduction, what we call prepare them, don't scare them. We've known from many generations of adolescents that violent anti-prom drinking movies just aren't very effective with kids running into trees and so forth. Teach them what to do, not what not to do. Prepare them, don't just scare them. Provide opportunities to develop their strengths and assets of what we call building their connections. I don't have time to show you the classroom activities and so forth, but I just want to make a couple points here. The fourth hour is designed to be delivered by teachers, but to be very interactive. It's taught by health class teachers who are also gym teachers, usually. So basically, you're teaching these skills like you would any other skill. You're teaching it like basketball. You don't go into the only say on the chalkboard about basketball. You go out and you play it and you practice it and you give them feedback, and that's fundamental to teaching about sports and athletics. That's what we do here. It is not a lecture. Kids will not learn it by some adult just explaining things to them. They have to talk about it themselves. They have to process it. These kids are doing an exercise we call naming the violence. The very first thing they have to do is sit down, choose some terminology, and decide what kind of abuse or violence is this. Just the basic thing. Is this financial abuse? Is this sexual abuse? Is this bullying or abuse of power? Just the basic language is fundamental. Kids don't even know that. And it should be interactive, it should be fun, and they should gain something by it. We have other video resources. We go to different communities when the whole attraction of the program is for the communities to develop videos that match their own communities and culture. So in Toronto, they made these videos. I'm not going to show them to you, unfortunately, but to teach kids about assertive, passive-aggressive types of communication so they understand the difference, to teach them about delay skills, negotiation skills, refusal skills, so they understand how to use those, when to use them, and how to practice them. And we teach them, and then there's combinations where we do that. So we usually get kids to make these videos either in a drama class or in a community agency, and then we show them in the classroom so kids can talk about them and use them as examples. Everyone, for example, knows how to be a bully. It's so easy to role play being a bully. It's not easy to role play being a bystander or to role play being a victim. You don't know what to do. Bystander is a really important job, and no one knows how to do it because you've never practiced it and you never see it. You don't have the nerve to stand up and say, hey, that's wrong. Now, he's a friend of mine. I'm not going to let you do that because you're afraid you'll be bullied. So you've got to practice it. They've got to see alternatives. Now, we did an evaluation of this, published in 2009, and we have several other trials. Well, we have a couple other trials that are just coming out, and then we've had some other data related to this first trial. But I just wanted to point out to you that the design was 10 schools that were randomized to controls and 10 that were randomized to the intervention. So it's a cluster randomized trial. My daughter, at the time this was happening, was just going into grade 9 in one of these schools. And I was sitting there thinking, okay, I hope that she gets the 4th hour school. She didn't. But I asked her one day when she was in the end of grade 8, and I said, Amy, if you get this program next year, I didn't know at that point yet, if you get this program next year, I'll be really excited to hear what you have to say about it. She said, what is it, Dad? And I said, well, we teach you about substance abuse and drugs and dating and safety. She said, I already learned that stuff. I already learned that stuff about drugs. So what are you talking about? She said, well, they taught us this past year about what LSD is. It's called acid, Dad. I said, yeah. You learned that it's called acid? And she said, yeah. And I said, what did you learn about it? Just to see how much kids really knew about this. I said, well, I learned that if you take acid, it kind of stays in your body like for many, many years, maybe even decades. I said, yeah, really? I said, yeah, that's why all these old people have acid reflux. She said it with a straight face. Because it keeps coming back and, they remember it. And I said, so sometimes kids think they know more than they might. What we did, though, is we randomized the kids we randomized the schools, about 1,700 kids in the public secondary schools. And we followed them to look at dating violence as a major outcome, because you have to pick one outcome. And we want to see, can you reduce dating violence if you start early, before it's really begun? We started in grade 9. It was very, very low incidence, because it really ramps up in grades, end of grade 9 through grades 10 and 11. So at the end of grade 11, we went and looked to see how it was doing. And basically, we did find a major reduction in dating violence, especially for the boys, even stronger for the boys than for the girls, 2.5 years later. We also found the school-wide buffering effect for kids who had maltreatment histories. These are kids who we had data on that grew up saying that they were, they fit the criteria for the types of physical abuse or emotional abuse cutoffs. Those kids were reporting fewer acts of violent delinquency than kids with maltreatment histories in the control schools. Something had shifted in the schools. When you start teaching about healthy relationships and when you start teaching about that respect, these kids who had the most vulnerability, knew the least about what a relationship was, were less engaged in violence. If that were to hold up, if we were to repeat that, and this is not a violent delinquency prevention program, but to me it does tell you that teaching healthy relationships has an effect in many different ways. We also found that the kids in small role play comparisons that we did, we took 100 kids from the controls and 100 from the intervention randomly and looked to see could teachers tell the difference if they watch these role plays. So they came in with a partner, just a peer from their class, and they had an older kid role play with them some of these activities to see what would you do under these pressures. And we found that the teachers were able to blindly pick out the ones that knew what they were doing, and they were in our program. They didn't know them and didn't know what they had received. We also were able to code that they were doing a lot better. So I'm not here to advocate that dating violence prevention programs are the only way to go about child abuse prevention. What I'm here to advocate is that all of you are educators, and we won't get this into the school system unless you guys start talking it up. Because I think to myself, I talk to groups like this about it, and it's very receptive, and I think you probably get what I'm saying and buy what I'm saying. But you're going to go back and maybe it doesn't affect your day-to-day world because you're not in the classroom or you're not dealing with curriculum. I'm glad the minister's here because now we can talk. But this is such a critical key issue. How would you affect that program? Or if I talk to educators, they don't know much about child abuse and neglect. They just want to know, what am I supposed to teach? So who am I supposed to address this to? I think everybody, for the most part, but especially those of you who are willing to go beyond what you do every day and say, let's do something a little bit broader. Let's teach everybody about relationships, because that is at the core element of child abuse and neglect. To me, addressing multiple risk factors through relationship connection shows a lot of promise. The timing of the intervention is very important. We know that for substance abuse, for example, you have to start before grade 9 because we're already starting that. We think the timing for dating violence prevention is very good in grade 9 because they're just getting into the importance of dating relationships. We also need to address more of the girls' concerns. We learned from our program the girls didn't get the same message as the boys. Fortunately, if the boys hadn't shown change, we wouldn't be anywhere. I wouldn't be talking about this today because they're the ones that are typically driving the violence. But if you hung around adolescents these days, you'll see girls are real different than they used to be. And they will say that they hit their boyfriends a lot more than the boyfriends hit them. What's going on there? It's a whole other topic, really, but an important one. And introducing healthy relationships early in the curriculum and throughout high school seems warranted. Our program is delivered right now in grade 9s, the core program. We developed one in grade 7 and one in grade 8, so that when kids enter, that's a critical middle years, roughly ages 13, 14, 15, so that they get a dose here, they get a dose there, and then they get a dose in grade 9 in their health class. This is how we do math and English, isn't it? This is how we do other important subjects. The days of having someone come in for an hour and say, don't do that, don't hit, this is what's wrong, this is what happens, are over, because it's not enough. The message will not sink in, and it could be delivered, it could be interpreted by the kids as it's not that important. If this is important, we have to introduce it early, and we have to introduce it every year. It doesn't have to be lengthy, it doesn't have to be tedious, but you can introduce these concepts in grade 1 and 2 and 3, and on up, about relationships, about respect of others. In fact, those ages of kids are much easier to address, because they know it's wrong to call people names. They know it's wrong to pick out people because of the color of their skin or their hair or their sex. They understand that, but then it disappears as they work through the peer culture. We need to embolden them more and teach them more about that, teach them about bullying, because that's an entry key for them at that age. Teach them about healthy relationships. What we're doing now is adding some concepts around mental health into that curriculum, because in order to have healthy relationships, you also need to have a sense of health and well-being. And so again, the schools are the place to do that. These concepts are not that difficult to teach. And in Ontario, we're on the cusp now of changing the curriculum. So not only do you have to teach about personal safety and injury prevention, but about mental health. And what they wanted to do initially was, let's teach kids in grade 7 what schizophrenia and major depression is. I said, no. You don't go into grade 7 and teach kids about cancer. You teach them not to smoke. So teach them what you want them to do or not do. Don't teach them what the disease is. That's not that critical. So developmentally, there are many places where we can fit this along our curriculums. I think that that's the place to deliver this message. My hope for the future is that my grandchildren, which by the way I don't have, and my kids aren't married, but my wife went out and bought 3 beautiful little sweaters for infants yesterday here because they're so great. In anticipation, she's already labeled them. Got a pink one, a blue one, and a who cares. My hope is that my grandkids enter into grade 1 and 2, and they're taught these messages from the beginning. It's introduced just like we do seatbelts and bicycle helmets today. It's just a basic fundamental message for kids about personal safety and awareness and health. It's fundamental. It's easy to teach. Teachers can do it. Teachers teach every kid. This is the way I think that we teach child abuse prevention. So thank you very much for listening to me. And I think we have a moment for questions.